Dear Lagosians, good afternoon. I think it's also proper to say Happy Mother's Day. It has become necessary for me to address you again, as promised, with an update on the COVID-19 situation in Lagos State. Since my last address on Friday, 20th March 2020, we have seen an increased number, and we have a total number of about 19 in Lagos now, and about 3 that we're still putting under suspect. First, let me say that this confirmation are evidence that the system is working, that we are actively and promptly tracking and testing suspected cases. Let me also reiterate that it also confirmed that we have been able to isolate all of these cases at Mainland Infectious Disease Hospital in Yaba, and they are currently undergoing various levels of treatment. We have also been working closely, like I did mention on Friday, with the federal government, the Federal Ministry of Health, and the Nigerian Center for Disease Control, the World Health Organization, and the UNICEF. I'm also happy to note that it's all not gloomy news, and that you remember that late on Friday, the index case, the Italian, who was diagnosed on the 27th of February 2020, has since been discharged and has been handed over to officials of the embassy of the Italian mission in Lagos. And we're happy to also say that he gave us some of his blood samples, which are being used as a means of also assessing other issues as we go on. In terms of proactive measures we are taking to protect Lagos from this disease, we have shut down all public schools and private schools, and we've also shut down our institution of higher learning. And we have also instructed that we should not allow congregation gathering of more than 50 people at any time. I want to use this opportunity to thank Lagosians who have obeyed this directive, which in no way was meant to deprive anyone his or her freedom. We've seen many mosques that were closed on Friday, and we've seen several churches as well that were also closed today. But in addition to this directive, I am now hereby also directing that all public officers in the entire unified public service from grade level 1 to 12, which constitute about 70% of our entire public workforce, should stay at home from Monday, 23rd March 2020 for 14 days at the first instance. We will review this as time goes on. Members of the public are advised to refrain from visiting any of our public offices and to transact such businesses as is possible, that we can do this on the phone or online channels. This stay at home does not affect all of our first responders, meaning the medical personnel are still meant to be at their duty posts. Our fire service, members of the Lagos State Emergency Management Authority, LOMA, and other essential services are not affected by this directive. We're working to wrap up our capacity to take on new cases as they are confirmed. Other health facilities will in due time be deployed to support the Mainland Infectious Disease Hospital. In fact, to mention that we have evacuated other patients out of that hospital, and so the hospital will be locked down only for the COVID-19 cases alone. And so we're wrapping up also the infrastructure and the renovation in that particular hospital to be able to take additional patients. We're also setting up additional facilities at both at Bagada General Hospital, and we've also identified locations in our 5 Ibile division around the state, just so in the event that we need to wrap up isolation center at the various locations outside of the infectious disease center in Yaba. More health workers are also being trained and retrained, and we've put on notice some of our retired nurses and doctors who we believe will come at this very time to support our health personnel who are working so tirelessly at this time. Regarding our directive limiting gathering to not more than 50, it is unfortunate that we have some cases of people who have not obeyed this directive. After consultations with our various religious leaders and our community leaders, as stated on Friday, we want to reiterate and say that government will frown at anybody or at any formation that is not obeying this directive. And I want to also insist that this is not a religious matter. It is simply a matter of morality and responsibility. Times like this call for a heightened commitment to doing the right thing, and we are as strong as our weakest links amongst us. I would hereby also reinform and state again that our law enforcement agencies are empowered to ensure that there is strict compliance with this very important public health suspension of gathering of not more than 50 people. I'm also using this opportunity to encourage the organized private sector and other companies or institutions of like mind to follow appropriate step and see if there are staff that are not of essential service, to encourage them to also ask them to stay at home and to be able to reduce incidents of public gathering and social contact. All traditional rulers should also instruct all their subjects and sensitize them on the need to avoid all traditional ceremonies and gathering at this time. I would like to reassure all our people that there is no reason to panic. We are fully prepared for this emergency. Thankfully, the federal government has also issued a directive that the Murtala Mohammed International Airport be closed to flights from tomorrow. What that means is that about 70 to 80% of the staff that we have there, which are health personnel that have been embedded at the airport for almost 2 months, will be available and join our other medical personnel on the frontline battle to curtail and defeat this disease. This time calls for strict adherence to directives that we've issued by our health authorities. Social distancing, obedience to simple rules of hygiene, such as covering your mouth while you cough and sneeze, no handshaking and touching of nose or faces, regular hand washing with soap and water, and regular use of hand sanitizers where available. If you're sick in any way, stay indoor and call a doctor. If you have just returned from overseas, please, and please again, practice the mandatory self-isolation for at least 14 days. I will repeat, if you have just returned from overseas, practice self-mandatory isolation for at least the next 14 days. Let me also use this opportunity to send messages to our elderly amongst us and to the very vulnerable, by which means those with existing health conditions to take extra special precaution and avoid anything that might expose them unnecessarily. It is also important for us to be vigilant. Our special coronavirus helpline, which is 08000 Corona, which is 08000 Corona or 08000 267 662, is free of charge to use. I must employ that. You don't need to call it if you have something scratching your head. You don't need to call it if a fly has just bitten you. It's only when you know or you feel that you're sick and you have symptoms of the things that have been explained by health officials that you need to call it. We are also aware of the economic effect of this virus. Our administration is working out how to cushion the impact of this disruption on the people of Lagos, especially the poorest and the very vulnerable amongst us. We will ensure that no one is left behind at this time. As I mentioned on Friday, there's no doubt that these are challenging times for all of us, demanding a change in our behavior and attitude across all strata. We must boldly rise to the demands of the time, knowing that this is only the way to avert the worst and guarantee a healthy and safe tomorrow for all of us. I hope that we'll all work with me and my colleagues to keep all of us safe and to keep Lagos moving forward again. Again, this is not the time for fake news and unverified news, especially on the social media. Let me also appeal to the media community in its entirety to support the battle by helping amplify these various guidelines and advice of all the contact numbers that we have set out. There will be no let up in our determination to battle this coronavirus to a standstill. We're sure that we'll win this battle, and we've always won in Lagos. And with your cooperation, with all of the corporations, we're believing that this will also pass over us very quickly. I want to thank all of you for listening, and I hope that there will be one or two questions or clarifications that we can take. Thank you very much. Like I said, we've explained this, and we're certainly explaining it again. When you have an outbreak like this, is to understand how it evolves, right? And we're thankful, like we said, that the inflow, the source, because it's not a local virus, it's an imported virus. So the source is that we're closing down all our international travels, right? And Lagos, the federal government has given the instruction from tomorrow, that entire source is blocked, right? So there will not be, from tomorrow close of business or from tomorrow midnight, no other international flights into the country again. So the source is completely blocked. So what we will now need to deal with will be the community effect of it, and which we're currently dealing with, which we're currently attacking. So that's why we've explained, I've said that, people must be able to self-isolate themselves if you have just returned from a journey abroad. We're appealing and we're insisting that you need to do that for yourself and for the community you live in. 14 days at the minimum, self-isolate yourself if you have just come back from an international travel. The second level is that we're doing contact tracing, and the entire machinery at the Infectious Disease Center have been equipped to do that. The numbers are increasing and we're ready. I've just explained now that we've taken out all of the other patients in that hospital. That entire hospital has been ground zero for coronavirus. I've also explained that we've set up another isolation center at Bagada. And I've also explained, that we're setting up isolation center in all of our divisions, in all the 5 divisions. I certainly cannot tell you what the address is. Mine is to tell you what we have done. And so we've gone round since 2 days ago, and we've identified locations in the Ibile division, just so that if anything happens in Badagry, we don't have to come to Yaba. We can isolate you in Badagry. If it happens in Ekpe, we've identified a place we can isolate you in Ekpe, and that's how you can curtail, the movement. And we're working and we're ensuring that even some of our retirees we've started talking to, we've triggered them, and they're waiting to be called upon if there's a need for that. Regarding non-compliance, so if it is a facility, be it an event center, be it a cinema, I'm re-emphasizing now, a cinema, be it a restaurant, be it a club house, be it a religious house that does not observe it, the Lagos State Environmental Protection and the Lagos State Safety Commission have the powers to shut down such facility. So they will be sealed off completely. They will be sealed off completely, and they also have the men of the Nigerian police working with them to ensure that we seal off such facilities immediately. Right, and so that's what has been happening since yesterday. We've actually had to shut down some event locations between yesterday and today. Right, and even some religious organizations, we've had to ask them to desist and stop whatever they're doing. Right, that's on one part. So the rule, the force of the law is behind our 2 agencies that have been empowered to go around which is the Safety Commission and LASEPA, to ensure that they can ensure compliance with this. Regarding the markets, even coming out from this meeting, we've had conversation with the headship of our markets, from the Iyaloja General to all of the market men and women. And part of the things we have said to them is that, advocacy, they need to also scale it up immediately, right? That they must ensure that even when people come to the market, they begin to obey this self-isolation and movement away. And so today, we've called them and we've passed on this message to them. The Commissioner for Local Government and Chieftaincy has also been directed tomorrow to ensure that we go around again. At the leadership level, we have instructed them, and you begin to see, this information being passed down from tomorrow at all of our markets, that we have. At the various bus stops and our buses, I also mentioned to you on Friday that we're working with the NURTW, that's the Road Transport Union and Workers. And they are working with us, they are cooperating with us. And we've also given directive that on our big buses, let's ensure that it's only a sitting and passengers that they carry. People should not be standing on those buses. They have a capacity for 47 passengers. That is the maximum, and still keeps with our 50 maximum gathering, so which keeps it safe and secure. And that's also why we as a government are taking the lead to reduce our staff coming to office from tomorrow. If I can stop over 70% or about 70% of my staff not coming to work tomorrow, meaning that I've taken a sizable number off the road. And so we're also appealing to the private sector who have non-essential staff that can also communicate with them and tell them and restrain them just to stay at home. 14 days, I'm sure, will not hurt anybody, and we'll come out of this together. Well, I can only speak for my state, and I can speak for my staff in Ministry of Health. And I'm also aware that the Honorable Commissioner has since reached out to his colleagues, in the private sector. And I'm excited that, because what I hear is that a lot of them, quite a number of them, are willing to support us and to join us, to have their skills available. So some of them have actually reached out to us, and we're excited about that. But our staff in the Ministry of Health, in all our health formations, have been activated. They are good to go. And like I did mention too, if we need to also call in our retirees. People that retired a year, 2 years ago, still have all the skills. It's just a day or two refresher course that they need to have, and they'll be ready, to move into all those facilities and help out. So we've also reached out to them. We also have some engagement around one of the things we used to do, health missions. So we've also activated everybody that has done one form of health mission or the other with government. We've also activated them to be super ready in the event that we need to call on them. Thank you very much also for reminding us that part of essential services is electricity and water. Our water are already on the essential service list, right? But it's just to encourage both the Eko Disco and the Keja Disco that at this point in time, Lagosians will truly want you to scale up and ensure that you give them power, at their respective homes, just so that at least they will have a bit of comfort while staying back at home and observing the self-isolation that we've explained to our people to observe.